Our members have spoken and we have heard you, and we are trying to make sure that the services that we are providing are what you need to effectively respond to the global coronavirus outbreak. Specifically, Humentum is holding weekly spot polls to survey our members around the challenges that you're facing and how you're responding. The information we're getting from those spot polls is being shared with the member community as well as the larger international development sector, and we are using it to inform the work that we are doing going forwards. We are also holding weekly roundtables of members to allow them an opportunity to meet face-to-face over Zoom to discuss the challenges and the questions that they have around their coronavirus response. We're holding an executive roundtable once a week as well, which gives an opportunity for high-level human resources and operations leadership to get together again to exchange best practices and to discuss common challenges across the sector. We are using the Humentum Connect platform to allow members to discuss the coronavirus outbreak, and we have a dedicated coronavirus channel on Humentum Connect where we are posting credible and up-to-date resources, information, and guidance as it appears around coronavirus for the use of our community. We are also working closely with donor agencies, in particular USAID and DFID, to help coordinate their response and guidance to their implementing partners with how we as implementing partners are actually working. Humentum is playing what I believe to be a very important facilitation and liaison role between the implementing partner community and the donor agencies, and we are really helping to facilitate the feedback loop between all of these different actors within the international development sector to ensure that communication is flowing smoothly and that the guidance that is being rolled out is appropriate and is actually responding to the needs and challenges that we are encountering. As you can imagine, along with this, we're seeing that organizations are really thinking about business continuity planning, worrying about how they keep their programs running. We work in a mission-driven sector. It is important to us, first and foremost, what kind of impact we can have in the communities in which we work. We work with the most vulnerable and we work with them to make their lives better and to help them make their lives better. Our member community is concerned about staff welfare. They want to support staff, they want to answer their questions about sick leave, about how to support them, taking care of kids who may have been sent home from school, all of these various challenges we're dealing with. So here at Humentum, we have been reviewing how we work both externally and internally. Externally, we've had to make some difficult decisions which make sense in light of everything that's going on. We have canceled our face-to-face trainings through April 30th, and we'll revisit how we're going to manage those after that date. We have supplemented our already robust online catalog of courses, and so we are not only offering all of the courses that we've been offering already, but we have added extra resources around remote working, around business continuity planning, around staff management of staff morale, and related courses that we think are particularly relevant to the current situation. So one important piece of information is that we were supposed to hold our conference OPEX East Africa in Nairobi in the beginning of April. That has been canceled, but excitingly, we've decided to change this to an online venue. So we will be holding OPEX Africa online in early June. We hold weekly calls with staff to gauge staff morale and to hear back from staff about the issues and challenges that they may be facing so that we can craft our policies and our internal response to be as appropriate as possible to their needs. We are trying to be flexible, we are trying to adapt, and we are trying to really listen to and over-communicate with our staff.